Still talking health, in light of the emergence of the unidentified illness in Sokoto State, Dr. Jide Idris, the Director General of the Nigerian Center for Disease Control and Prevention, NCDC, has initiated a comprehensive response effort. Now, this mission led by Dr. Idris aims to coordinate with key stakeholders to address the situation effectively. Discussions during the mission focused on response strategies, case management, surveillance measures, risk communication strategies, and community engagement initiatives. Here's the full report.
In light of the emergence of an unidentified illness in Sokoto State, the Director General of the Nigeria Center for Disease Control and Prevention, NCDC, Dr. Jide Idris, has initiated a comprehensive response effort. Since its first appearance on March 21, 2024, the outbreak has resulted in 196 suspected cases and 7 deaths across Isa, Sabon Birni, and Ilela local government areas in Sokoto State. Presently, the illness has spread to neighboring localities including Zamfara State. Director General of the NCDC, Dr. Jide Idris, said the diagnosis of collected samples is ongoing, and once completed, information will be promptly shared with the public on or before next week Friday.
Initially, we thought it was a disease of infectious origin, and I think that's practically ruled out. So what we're waiting for now is the lab results of samples sent to the lab. I've been on the neck of the lab people, NAFDAC and NIMA. They did promise Friday. So as soon as these results are out, I think they'll be communicated to you. I know since we don't know what precisely is happening, we are limited in communications to the people, because as much as we want to advise the people, we cannot afford to give them a wrong information, which is what so. But the truth is that the thing is spreading. The last bit I had was in one local government in 7 wards, now in 3 local governments in 11 wards, which is alarming. If you're going to add that to what is happening in Zamfara, this is a bit serious. So we need to do all we can to address this.
In addition to technical aspects, the DG and CDC also engaged with traditional leaders, including a visit to the Sultan of Sokoto, briefing him on the mission's objectives. The Sultan commended NCDC's efforts and pledged support from the people of Sokoto in combating the outbreak.
To also wish you all the best in this onerous task of diagnosing what really the problem is with this outbreak. You are the professionals. I would believe you do your best to find out what really happened, how it happened, what could be done to curtail it, to stop the spread. Because our communities are intertwined into one another always, and we travel from one place to the other. Some of these diseases are infectious diseases sometimes, some of them might not be, but we are the professionals. But thank you for taking the prompt action. Really find out what really happened and what that disease is and how it can be surmounted. We assure you of our total support. Whatever you think we could do or we should do, we assure you we will do so.
With challenges such as limited diagnostic capacity in the state, the Director General highlighted the need for a definitive diagnosis center.
As early as we got the information about this case, we are doing everything possible to support the state and to unravel the cause of the disease. Well, I was informed that there are only 2 labs of this same type in Africa, one here and one in South Africa. And what I said was that the one here is not working. If it were working, perhaps we wouldn't have waited for this long. So I think we need to support and are part of our laboratory network with NCDC. So what I've asked for is the cause of the problem. They mentioned reagents and some maintenance issues. As soon as they gave me the details.
The NCDC stresses the importance of continued vigilance, cooperation, and public awareness campaigns to identify the illness, implement containment measures, and prevent further outbreaks.